I'm Marissa Warning. I'm a student nurse at the University of South Alabama, and today I'm going to be performing indwelling catheter insertion. So to begin with, we're going to gather our supplies and go to the patient's room, and we will verify the patient care orders, and we see that it is to insert and maintain the indwelling urinary catheter and place on nurse-driven protocol to remove the catheter when indications are no longer present. Then we will verify the patient identifiers. We see that this is Miss Jaguar Jones with the date of birth of August the 25th of 1963, and she has an allergic reaction to penicillin. Then we will check our 3 patient identifiers for the indications for the catheter. We see that it is required for immobilization for surgery, trauma, and other therapies. We see that it's for strict urinary output monitoring as indicated by the plan of care, for hourly monitoring for the urine output, hemodynamic instability, and high-dose diuretic therapy. And we also see that it is to assist in healing of open sacral and perineal wounds in incontinent patients. Then we will explain the procedure to the patient, and then we will pull a curtain to provide our patient with privacy. Next, we will position our trash can, perform hand hygiene, and don our goggles. Now that we've done that, we're going to position our patient. We're going to raise the bed, lower a side rail, position our patient in dorsal recumbent with the legs slightly bent. These paper towels, they're not going to move. And then we're going to perform hand hygiene and put on our clean gloves. Okay, now that we have our clean gloves on, we would normally clean our patient. For a female, we would clean with a towel. We would use separate sides of the towel for each clean, and we would clean the furthest away labia, and then the closest, and then in the middle, each using different sides. And then for an uncircumcised male, we would retract the foreskin, and we would, in three times, use separate cotton swabs to clean from the urethral meatus on the glands in a circular motion. And then for a circumcised patient, it would be the same, except you wouldn't retract the foreskin. And then now that we've done that, we're going to take and open our kit. Okay. We're going to make this a trash can. And now we're going to open this farthest away, and then sides, clear the 1-inch border. Okay. And now we're going to remove our clean gloves, perform hand hygiene. We're going to apply our sterile gloves. Now that we have our sterile gloves on, we're going to take out our drape. Still being sure of the 1-inch border. We're going to place it shiny side down. Just this way. Okay. And we are going to now remove our tray. Turn it around and place it here in the middle. And we're going to remove our supplies. Discard. I'm going to add lube to the tray. Discard And now we're going to connect our water to the catheter. Okay. Now we're going to lube up the end of our catheter. You would lube 1 to 2 inches for a female and 5 to 7 for a male. Okay, we're going to leave that in there. Now we're going to begin to clean our patient. You clean one here. And here. And now we're going to grab our catheter, pull it this way. We're going to insert it until we have urine return. And then after you get urine return, you're going to push 1 to 2 more inches, and then for a male, you would go for urine return and then to the bifactorum. Now we've inserted our water. We're going to remove the syringe, and we're going to pull to make sure that our balloon is stable, and then allow it back into the bladder so there's no pressure. Now we're going to hang our bag. You would normally hang it on a bed rail. For the purposes of not having one, we're going to hang it on our finger. And we will collect a urine sample. So, you would also apply our stat lock first. So we're going to throw that away, and then we would clean the patient's thigh, and then you would put the stat lock like this in there. Ours is kind of broken. We're not going to do that, but it's sitting there. And so now you would collect your urine sample. So we're going to take and open on this side. And you're going to open it and allow the urine to go in. Close it. You would send that to the lab. And then for collecting urine from the port, you're going to clamp your tubing. You're going to clean with an alcohol wipe. You would take a 60 milliliter syringe and take out your urine sample, and then you would inject it into your specimen cup without touching the sides. And then you would unclamp and send your urine samples to the lab. And now we're going to clean up our station and discard of our materials. We don't have any room in our trash can. And then I would remove my sterile gloves. Okay. And we would perform hand hygiene, position the patient. So we'd lower the patient's bed, raise the side rail, and we would position our patient with our call light at the most accessible point so that if they need anything, they would be able to get in touch with us. And then we will return to the nurse's station to document the catheter size. We would document the amount, the color, the consistency of the urine. We would document our patient's response, and we would document the specimen that we collected. We would also be sure that our patient knows that we're going to come in daily to provide catheter care and clean, and then we would also remove it as soon as doctor's orders and there were no indications to need the catheter anymore. Okay, and at this point, we're going to remove the catheter. So I perform hand hygiene, apply my clean gloves. And we would take and clamp down. We would pump our syringe to loosen and leave 0.5 air and allow gravity to remove our water. Okay. Now we're going to remove the catheter and dispose. And we would then return to the nurse's station to document how the patient handled this procedure, the amount, the color, the odor, the consistency of the urine. We would make sure that our catheter was intact, and we would also want to measure the amount in the water from the balloon, and we would also teach our patient signs and symptoms of a UTI, such as frequency, urgency, and painful urination. And then we would also make sure that they knew that we had a plan for them to void within 4 to 6 hours. And if they did not void in that time frame, we would come in and palpate the bladder and possibly perform a bladder scan. And we would remove our sterile gloves, or clean gloves. And that is the end of my checkoff.